Welcome to the Victory Education Lounge. We're glad you're here. Our mission is to provide you with the knowledge and insights you need to ace your residency interviews. Today, we're tackling an intriguing question that often pops up in these interviews. Can you discuss a case that had a significant impact on you? Now that you're ready to embark on this exciting phase of your medical career, don't forget to hit the like button, subscribe for more content, and share your thoughts or questions in the comments below. Let's dive into this critical residency interview period and move one step closer to your residency goals. This question offers a unique opportunity to showcase your clinical experiences, your problem-solving abilities, your empathy for patients, and your capacity for self-reflection and growth. So how do you approach it? What should you focus on? And how can you use this question to demonstrate your suitability for the residency program? Over the next 15 minutes, we'll explore these questions, providing you with a roadmap to craft compelling, authentic responses. So grab a cup of coffee, sit back, and let's dive in. Today, we're diving into one of the most introspective questions in residency interviews. Can you discuss a case that had a significant impact on you? First, focus on the patient impact. In your journey as a healthcare provider, you've likely encountered cases that have touched your heart. These are instances where, beyond your medical expertise, your empathy and communication skills were called into play. Discussing such a case can be a powerful way to illustrate your commitment to patient care. For example, consider this narrative. Early in my residency, I was assigned to a young patient suffering from a rare, hard-to-treat condition. The complexity of the case was daunting. The patient was scared, and their family was desperate for answers. But I was determined to help. I threw myself into researching the condition, often staying up late into the night, reading case studies and consulting with specialists worldwide. My goal was not just to treat the symptoms, but to find the best possible solution for my patient. The breakthrough came when I discovered an innovative treatment plan being used with success in another part of the world. I presented the option to the patient and their family, and we decided to give it a try. The following weeks were a whirlwind of treatment adjustments and regular check-ins. But slowly, the patient began to improve. Their strength returned, and the fear in their eyes was replaced with hope. The day the patient was discharged was one of the most rewarding of my residency. The family's tearful gratitude was a powerful reminder of why I chose this profession. I realized then that our role as medical practitioners goes beyond diagnosing and treating conditions. It's about making a real difference in people's lives, using our skills to bring hope where there was despair. This case was a significant milestone in my journey. It taught me the power of perseverance, the importance of thorough research, and the profound impact we can have on our patients' lives. It was a reminder that at the heart of medicine is the patient, a human being relying on us to help them navigate one of the most challenging times of their lives. Seeing their recovery and the family's relief was profoundly rewarding. Secondly, discuss learning from a mistake. Harnessing the power of an honest mistake can be an effective way of demonstrating your professional growth. We all make mistakes, but what sets us apart is how we recover and learn from them. This approach allows you to showcase your resilience, your ability to accept responsibility, and your commitment to continuous learning. Now, it's important to choose a mistake that is serious enough to be significant, but not so severe that it implies negligence or incompetence. It could be a misjudgment, an oversight, or a misunderstanding. The key is to focus on what the experience taught you and how it shaped your professional practice. For instance, you could say something along these lines. Early in my residency, I encountered a challenging case which tested my diagnostic skills. I misinterpreted a test result which led to a delay in the appropriate treatment. However, upon further review and consultation with a senior colleague, I quickly realized my error. This was a pivotal moment for me. I felt a deep sense of responsibility for my lapse and immediately corrected the treatment plan. This experience served as a powerful reminder of the importance of thoroughness and humility in my practice. It taught me that it's okay to ask for help or a second opinion when I'm not entirely sure. It reinforced the importance of double-checking, especially with complex cases. And most importantly, it underscored the value of collaboration and the strength of collective wisdom in healthcare. From that day forward, I committed myself to a rigorous practice of rechecking my work, seeking advice when needed, and continuously learning from my experiences. This mistake was a stepping stone in my journey, shaping me into a more attentive, collaborative, and resilient healthcare professional. So, don't shy away from discussing a mistake. It's not about the stumble, it's about the recovery. And remember, it's through our mistakes that we often gain our most valuable lessons. This taught me the importance of double-checking and collaboration. Third, choose a technically challenging case. This tactic isn't for the faint-hearted. It's for those who've delved into the complex world of medicine and emerged victorious. It's all about highlighting your problem-solving skills and medical knowledge. Let's imagine a rather challenging scenario. You're presented with a case that requires a rare surgical procedure. It's not something you've come across in your textbooks or medical rotations. What do? Do you step back, or do you rise to the occasion? The answer, of course, is to rise. Rise to the challenge and show your potential. You take the initiative to learn about the procedure, spending countless nights poring over medical journals and consulting with specialists. You don't just stop there, you take it a step further. You work closely with the surgical team, observing, learning, and contributing to the planning discussions. This is not only about showcasing your medical knowledge, but your perseverance and dedication. It's about the countless hours spent learning and preparing for this unique case. Now let's put this into an answer. Picture this. During my rotation in neurosurgery, I encountered a case that required a rare procedure known as a hypothalamic hamartoma resection. I had never been part of such a case before, and it was a steep learning curve, but I was determined to contribute meaningfully to the patient's care. I spent nights reading up on the procedure, understanding every step, every risk, and every possible complication. I consulted with specialists, participated in the surgical planning, and was actively involved in the patient's post-operative care. It was a challenging case, but it was also incredibly rewarding. Not only was the surgery successful, but I also learned a lot of my capacity to adapt and learn in demanding situations. And there you have it. That's how you discuss a technically challenging case. Remember, it's not about showing off, but about demonstrating your ability to rise to a challenge and your commitment to patient care. I took the initiative to learn the technique and worked closely with the surgical team, contributing significantly to the successful outcome. Scene script. Fourth, emphasize teamwork and collaboration. When you're part of a healthcare team, it's not just about your individual skills and knowledge. It's about how you synergize with others to deliver the best patient care. Interdisciplinary cooperation is often the backbone of successful patient outcomes, and highlighting this aspect can showcase your ability to work in diverse teams and handle complex cases. Let's consider an example. Imagine a case where you're faced with a patient suffering from a multifaceted condition. It's a complex case that requires the expertise of various specialists. Here's how you might discuss it. One of the most impactful cases I've been involved in was a patient with multiple comorbidities. The patient's condition was so complex that it required the expertise of several specialists, including cardiologists, endocrinologists, and nephrologists. As a resident, I was given the responsibility of coordinating the team and ensuring effective communication among the specialists. At first, it was challenging. Each specialist had a different perspective, and there were times when opinions clashed. But I learned the importance of fostering an environment where everyone felt heard and valued. I facilitated discussions, encouraged everyone to share their insights, and made sure that everyone was on the same page. We held regular interdisciplinary meetings where we discussed the patient's progress, adjusted the treatment plan as needed, and ensured that everyone was updated with the latest information. It was a rigorous process, but it was also incredibly rewarding. Seeing how the different pieces of the puzzle came together to form a comprehensive treatment plan was a testament to the power of collaboration. The result was a successful patient outcome that wouldn't have been possible without the concerted effort of the entire team. But more than that, This experience taught me valuable lessons in team leadership and interdisciplinary communication. It made me realize that in the field of medicine, teamwork and collaboration aren't just nice-to-have qualities, they're absolutely essential. This collaborative effort not only led to a successful patient outcome, but also taught me valuable lessons in team leadership and interdisciplinary communication. Lastly, discuss a case with a personal connection or insight. This strategy invites you to delve into the human aspect of medicine, the part where your personal life intertwines with your professional one. In these moments, you don't just see a patient in front of you, you see a reflection of your own experiences, your loved ones, and your personal journey. This is where the line between sympathy and empathy blurs, allowing you to connect with your patients on a deeper level. Let's take a look at an example. Picture this. You're treating a middle-aged man battling a chronic illness that your own father once fought. His struggles mirror the ones you've seen up close. His fears echo the ones you felt personally. You're not just his doctor, you're someone who understands his journey, perhaps better than most. So how would you articulate this in an interview? Here's a possible answer. There was a patient I treated, a man in his 50s, struggling with Parkinson's disease. This case hit close to home, as my father had battled the same disease. I could see my father's resilience in his fight, his fears in his eyes. This personal connection made me more than just his doctor. I was someone who had been in his family's shoes, feeling their pain, their hope, their despair. This connection allowed me to provide him not only with medical care but also with emotional support and understanding. It reminded me of why I chose this path, why I wanted to become a doctor, to be there for people in their hour of need, to empathize with them, and to make a difference in their lives. It was a stark reminder that medicine isn't just about treating diseases, it's about treating people. This personal connection gave me a deeper understanding and empathy, influencing my approach to patient care. Remember, it's these personal insights that make you more than just a doctor. They make you a healer, a confidant, a beacon of hope. And isn't that what medicine is all about? Remember, authenticity and reflection are key in your answers. As we've explored, discussing a significant case isn't only about medical details, but a way to showcase your empathy, your learning curve, and your professional growth. It's an opportunity to illustrate how you have evolved as a medical professional. We've discussed 5 different strategies that can help you effectively answer the question, can you discuss a case that had a significant impact on you? Firstly, focusing on the patient impact allows you to highlight your empathy and communication skills. Secondly, discussing a lesson learned from a mistake demonstrates your ability to learn and grow from challenges. Thirdly, choosing a technically challenging case emphasizes your problem-solving skills and medical knowledge. Fourthly, emphasizing teamwork and collaboration shows your ability to work well with others in an interdisciplinary setting. Lastly, discussing a case with a personal connection or insight gives you the chance to showcase your deeper understanding and empathy. Each of these strategies is unique and offers different insights into your growth and learning as a medical professional. The key is to choose the strategy that best aligns with your personal experience and the message you want to convey. Remember, it's not about impressing with a complex medical case. It's about showing your journey, your growth, and the values you bring to the profession. It's about being authentic and reflective, about showcasing the human side of medicine. Hopefully, these strategies will help you prepare for your residency interviews. And remember, each experience, each case is a stepping stone in your journey. That's all for today at the Victory Education Lounge. If you found this helpful, like, subscribe, and comment for more. Good luck with your interviews.